Scanning the room.
Hello, my name is Joyce Jones. I'm an ADN student here at Wilson State College, and today I will be demonstrating IV administration via Piggyback. So to get started, I have obtained my client's orders in her MAR, and I will just double check that this information matches up. So I have Shirley Cost, 5/14/1964. I know that the provider has already ordered sodium chloride, 1,000 milliliter bag at 100 mils per hour, and that is already infusing in my client's room. I've already went in and talked with her and explained the procedure to her and asked her if she had any questions. I assessed the site to make sure that the IV is good. And so now I'm just going to double check that all of this matches. And so again, we have the ceftriaxone 1 gram in a 250 milliliter bag with 0.9 normal saline infusing over 60 minutes. I've double checked that this medication is compatible with the medication that's hanging up in the room. I have asked my client about her allergies, and she said that she is allergic to promethazine and codeine. And I can see that here on my mark. So now I will just get started with my first medication check. So I've entered the medication room. I performed hand hygiene. I'm going to go ahead and put on some gloves. And so I'll just start by double checking that the medication that I'm pulling from the Pyxis matches up with my Martin healthcare provider orders. So I have ceftriaxone 1 gram and 250 ml bag of normal saline. This is already a pre-mixed medication. So I'm just going to double check that the color and clarity is fine, that there's no tears or leaks, that it's a 250 ml bag, and that matches up with my ceftriaxone 0.9 saline 250 mils. And so now I will just go ahead and start my second med check by preparing the medication. So I want to double check that my label matches up with my patient and the medication prescribed, and it does. So I will go ahead and apply that to this bag. Okay, and so I just want to double check again that I have the right medication. So I have the ceftriaxone at 250 mils normal saline. And again, there's no leaks, its color and clarity is fine. I've obtained my secondary tubing and made sure that it's not expired, it's not tampered with, it's still good. So now I will take off my gloves, wash my hands, and enter the patient's room. So knock, 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 I enter the patient's room, wash my hands, put on new gloves, and I'm just going to verify that I have the right patient. So I have Shirley Cost, 5/14/1964. She told me she has an allergy to promethazine and codeine. And I will go ahead and get started with my third med check in administration. The client said that she didn't have any questions. And before I did all this, I did verify that my client has a need for this medication. So once again, I have the ceftriaxone 1 gram in 250 milliliters normal saline, and I have the right patient and the right birthday. So I'll go ahead and get started with my primary tubing. Okay, so I know that this is a medication, so when I'm priming this, I want to keep in mind not to waste the medication and priming it, only use as much as possible. So I'm going to go ahead and take off this, and before I do that, I'm going to close my clamp so I don't get medication everywhere. So close my clamp. I'm just going to go ahead and spike my bag. I don't know why I always grab it like that, knowing that I'm right-handed. Okay, so this is kind of hard to spike. Are you kidding me? Okay, now that I spiked my bag, I will go ahead and hang this up. And once again, I will squeeze the drip chamber to fill it at least halfway. My clamp is closed, so I'm just going to take this off and keep it sterile so that I can use it later. Okay, and just slowly rolling this up. I want to make sure that I get all the bubbles out and that my line primes well without wasting a whole bunch of medication. Okay, now that that's done, I'm going to go ahead and recap this using the aseptic technique. Okay, and I'm going to go ahead and label this tubing with my initials, date, time, so that the next nurse knows when it was put up. Okay, and so now I'm just going to get my alcohol wipe, and I'm going to clean this port right here so that I can put my ceftriaxone into my primary tubing and start the piggyback. Okay, so I clean that for 15 to 30 seconds, and I'm going to let that dry. Okay, it is dry, so I'll go ahead and take this off. That can go in the trash. And I'm just going to connect that to my cassette and undo the roller clamp, and I'm just going to go ahead and set my pump. So I'm going to take my gloves off for this part. Okay, so I'll just choose B. I want to clear all those settings. I'll go to my drug list, and I'm going to look for the antibiotic 250 mils because I know that's how much volume I'll be infusing. Okay, antibiotic 250 mils, enter, standard program. Okay, and I'm just double checking, it does say piggyback, antibiotic 250 mils. I'm going to set that at 250 because that is what the provider set it as. Okay, and I will just go ahead and push start. And I'm just verifying once again, making sure that I have the right medication once again, and I'll go ahead and start that infusion. Okay, and so I will document, I will stay with my client and assess her, make sure she's not having a reaction to this medication, clean my work area. I'm going to document the amount of, or the type of medication that I'm infusing, my patient's tolerance, date, time, and clean my work area, perform hand hygiene, and that's it.